Hey, this is Jeremiah Mars. This is my nursing full assessment. I'm just kind of showing the room. This is my patient. This is my mentor, and I'm going to set you guys over here just so you got a good view of everything. Make sure that's right. Okay. So I'm going to introduce myself. Hey, my name is Jeremiah. I'm your nurse today.
Nice to meet you.
Good. What I'm gonna do is I'm gonna do a full body assessment, and is that okay?
Mm-hmm.
Okay. The first thing I like for you to do, first I'm gonna wash my hands. Wash my hands. I'm gonna put on some gloves. Can you tell me your name and date of birth?
Christy Barnes, 3575,
Okay. And what year is it?
2021.
All right. And who's the president?
Joe Biden.
And what building are we in?
Hospital.
And what is your age?
46.
All right. So this patient to me seems like she's alert and oriented times 4. She's cooperative, follows commands. She's well kept. She's clean. Cognition looks to be intact. Looks like she's here. She's like knows what's going on. Okay. So what we're going to do first, I'm going to ask you a couple questions. Okay. So when you're at home, do you use any kind of devices to get around the house?
No.
Okay. So what I want you to do is just kind of stand up and just kind of walk towards me. All right. And then just turn around, walk back and sit down. Now what we're doing there is we're just checking her gait, make sure everything looks okay. How about glasses? Do you wear glasses at home?
No.
No glasses at home. What about contacts?
Nope.
Okay. How about hearing? Do you have any hearing deficits or wear hearing aids or anything like that?
Mm-mm.
Okay. So everything is normal according to her, and we're going to evaluate that a little bit further. All right. What I like to do first is get a set of vital signs, okay? Normally, we check her blood pressure. We want to make sure they've been sitting for at least 5 minutes, make sure their feet are flat on the floor. And then we would be checking the disc, but this is what I got. So just do that, check the blood pressure. While she's doing that, I'm checking respirations, checking the temperature. Good. 97.7. Okay. All right. 120 over 80. Respirations were 18, so that's within normal range. And then we'll go over the pulse and her pulse in a minute. What we're going to do first is we're going to make sure cranial nerves are intact. And what I'd like for you to do is close your eyes and take a smell of this and just tell me what you smell.
Soap.
Soap, okay. Smell seems to be intact. Now we're going to look at cranial nerve 2. I'm going to hold this piece of paper and you just tell me what it says on the bottom line.
A, B, C, D, E, F, G.
That's correct. So she looks like she has 20/20 vision according to the Snellen chart I'm using. And what I want to have you do now is just kind of stare at something, focus on something over there, and we're going to check your pupil reaction. Okay? All right, and so that was, her pupils were 3 and they went to 1, so that's normal. Next thing we're going to check is we're going to kind of check her peripheral. What I want you to do is let's cover your right eye. Yeah, and I'll cover this eye. Yeah. And tell me how many fingers you see.
One,
Alright, let's do the other side. How many fingers do you see?
2.
Alright, we tried that. Now we're gonna look at her ocular movements and check her peripheral fields. So just follow the light, okay? Don't move your head, just move your eyes. And what we're looking for when we do this assessment, making sure that the eye movement is normal, no jerky patterns, nothing like that, and that everything is moving like it's supposed to be, and it looks like it is. So that is basically 3, 4, and 6, and 2. Let's do 5. 5, I need you to kind of bite down. Teeth again. I'm gonna rub this piece of cotton on your cheek. Did you feel that?
Mm-hmm.
Okay. How about that?
Mm-hmm.
All right, so that's 5. 7. What we're gonna do is, can you smile for me? All right, and can you make a frown, sad face, frown? There you go. And puff your cheeks out. All right, and what we're looking for that, good, is symmetry, and make sure there's no facial droop or anything like that going on. Alright, so 8, we're going to do a whisper test and kind of check her hearing. So I'm gonna cover your ear and whisper something. You tell me what I say, okay?
Dog, cat,
Alright, and we'll try this side too.
banana, apple.
Alright, so that's 8. 9, what we're going to do is we're going to check your gag reflex. And what you would normally do is take a blade, put it in, and just check her gag reflex. We're going to say her gag reflex is there. 10, we're going to check, we've already heard her talk, so we know she can talk. The next thing we're going to check on our patient is, can you swallow for me? Do you have any pain when you swallow? Okay, so that's good. And then for 11, what we're going to do is look for movement, and we're going to have her shrug her shoulders. And can you turn your face to the side? All right. Just one more time. All right. And then lift your shoulders. All right. And for the last cranial nerve, number 12, we're going to have you stick your tongue out and move it side to side. Is that as far as you can stick it out? Okay. So that seems to be intact too. So what I'm gonna do now is I'm gonna start with your head and work my way down, and we're just kind of assess you, okay? I'm gonna start with your head. Is that okay?
Mm-hmm.
All right. So looking in your head, making sure we don't have any sores, any wounds, any kind of infestations or anything like that. I don't see anything. Have you had any headaches or anything?
Mm-hmm.
Any pain?
No.
Okay. Next thing we're going to check is their sinuses. I'm going to push on it and you tell me if you have any pain, okay?
No. No.
Okay. I'm going to look at your ears real fast. Any pain when I touch your ear?
Mm-mm.
Okay. How about this side over here?
No.
Pain?
Mm-mm.
Okay. We'll look at your eyes. And what I want you to do is just kind of open them. I'm going to pull it down, and everything looks good. No yellows, white like it's supposed to be, and it's red at the bottom. Next thing we're going to do is I'm going to look at her nose, make sure there's not a deviated septum, make sure there's no blockages. Have you had any trouble in your nose, any pain or breathing problems? Okay, can you do me a favor and cover one nostril and breathe? Alright, and then the other side. And what we're doing for there is make sure we just, we have good breathing there. Alright. Next thing we're going to do is look in the mouth. Can you open your mouth up really wide? Alright, so she has her tonsils in there. Can you stick your tongue out? Looks like do you have all your teeth?
Mm-hmm.
So you don't wear any dentures or anything like that, okay?
Mm-hmm.
And I noticed that she has this pink, moist, and intact. There's no sores. You have any problems with your mouth or any pain lately?
Mm-mm.
Okay. Alright. So, the next thing we're going to do is we're going to go over your neck. I'm just going to make sure that what we do is check your neck. So if you could just look up for me. Good. Alright. Now turn your head to the side. And then the other side. Alright, good. So what we're looking for here, lift your head up again. There you go. We want to make sure there's no distended jugular veins. We want to make sure the trachea is midline. Can you swallow for me one more time? This is another good opportunity to look at that. We're going to feel the carotid pulse. Good. One at a time. And good. While we're here, I'm going to look at our cervical lymph node. Thing there looks good. Thing there looks good. Have you had any pain in your neck?
No.
Okay. I'm just going to listen to your carotid pulse, okay? Okay. The next thing I'm going to have you do is stand up. You need help standing up? Are you okay? And what I want to look for is I want to look for symmetry in her thoracic. Make sure there's no barrel chest, no, make sure everything looks like she's breathing okay. So can you take a deep breath for me? All right, everything there looks okay. And can you say 1, 2, 3 for me?
1, 2, 3.
All right, and that's checking to make sure we don't have any, make sure there's no pneumonia. Make sure it didn't sound like it was vibrating from her lungs to her chest. That sounds good. And we're gonna listen to your lungs first, okay? Take a deep breath for me. And normally I would go more up under to listen to the lungs, but because this is my volunteer, I'm just saying I'm doing that. So all lung fields sound good in the front, so now we're gonna go posterior. All right, listen to your lungs. Hear your breath. Good. Good. And we're just making sure we don't hear any kind of wheezing or any sounds that are not supposed to be there. Stridor, crackles, that all sounds good. The next thing we'll do is we'll check for tenderness in her kidneys while she's back here. We'll go down to the bottom of her rib. Just kind of. Did you feel any tenderness with that? Okay. And while we're here, can you just bend over and touch the chair? All right. We're looking for the right curvature of her back. Do you have any pain when you do that?
No.
Okay. All right, you can turn around and sit down. The next thing I'm gonna do is I'm gonna listen to your heart, okay? what I'm listening for is a S1, S2, which is a love dub. And obviously I would be more, I would be underneath the clothes listening for this, but for this, I'm gonna be on the outside. Okay. And I'll also turn it on my bell so I can see if I could hear any murmurs. Okay. So I've assessed her lungs and I've assessed her heart. So the next thing I'm gonna do is her abdomen, and for that I'm gonna have her lay on the couch. Alright. I'm gonna look at her abdomen first. Make sure there's nothing that I see that looks out of the ordinary. Make sure that it looks symmetrical. Make sure I don't see any sores or wounds or anything like that. And then I would ask about our bowel movements and stuff like that. So, ma'am, have you had any bowel movements lately?
Yeah, today.
And have you noticed anything different?
No.
Okay, so are they normal? Okay.
Mhm.
And how about urinating? Have you had any pain with that? Is everything normal with that?
Yeah.
Okay. Alright, so I'm gonna listen to your stomach, okay? And with that, I listened to all four quadrants, and what I'm wanting to do is make sure I got sound in all of them. Alright, and we've got sound in all four quadrants. The next thing we're going to do is we're going to percuss and we're going to palpate. We're going to make sure there's no tenderness. Okay, so I'm going to go through all your abdomen. Tell me if you feel any pain with that. Pain with that? Okay, now. Okay. And then we'll do the liver. Change that. Okay. So I've assessed her abdomen. She's told me she's had normal bowel movements, normal urination, and we're just gonna kind of work our way down. I'm gonna check her popliteal pulses on her knees. I got a pulse in both of those. And then I want to go to her posterior tibialis. Alright. I've got a pulse in both of those. And then obviously her shoes and socks would be off, but we'd check for dorsalis pedis. And we got a pulse in those. The next thing we want to check for range of motion, and since she's already laying down, we'll check her legs. So what I'm gonna have you do, lift your right leg for me to about right here. There you go. Your left leg. Good. Do you feel any pain with that?
Yeah.
Feel any pain in here? Okay. And now I want you to lift your leg, and bend your knee. So here, any pain with that? And how about there? Good? Alright, we'll do the same thing on this leg. Good. Anything? Okay. Alright. So she's got good range of motion in her hips, her knees, and her feet. We'll have her push and pull on this. Pull, push, pull, there you go, and then push. There you go. She's got good range of motion in her legs. You want to get up? Okay. The next thing I'm going to do, I'm going to have her stand up. And what we're going to do is we're going to check your range of motion in your shoulders and elbows, okay? Now, have you had any pain in your shoulders that you noticed?
No.
Okay, none of that hurts. Okay. And then here, what we want to do is we want to make sure we don't feel anything cracking on her, something out of the ordinary. Anything with that, okay? Do the same thing on this side. Does that feel okay?
Mhm.
Okay. Okay. Well, while I have her hands here, I'm gonna check both of her radial pulses. And I got 202. I'm gonna go ahead and check her brachial pulses. Let's see. And then just while I'm doing this, through the whole assessment, obviously looking at her legs, her stomach, her chest, I would be looking at her skin, make sure there's no abrasions, no open wounds, no sores, checking her temperature. It feels warm, dry but not too dry. Skin turgor is normal. We would check her capillary refill, that's normal. Do it on both sides. Alright. And then I'll just say, do you have any other questions that you'd like for me to bring up to the doctor?
Mm-mm.
Alright, and then I'd have them sit down with a call light so they could call somebody if they needed to, and I would say goodbye.